What if you could take control of your health before a diagnosis takes control of you? In today's fast-paced world, where convenience often trumps care, more and more people, especially adults aged 18 to 50, are silently developing a condition that could change their lives forever. This condition is type 2 diabetes. Whether you're in New York or New Delhi, London or Toronto, this chronic condition does not discriminate. But the good news is, you have the power to understand it, manage it, and in many cases, even prevent it. Welcome to this video where we break down what type 2 diabetes is, its causes, symptoms, and treatment options, in the most relatable and empowering way possible. Let's begin. What is type 2 diabetes? Type 2. Diabetes is a chronic condition that affects how your body processes sugar, or, more precisely, glucose. Normally, when you eat, your body breaks down food into glucose, which enters your bloodstream. In response, your pancreas releases a hormone called insulin, which helps glucose enter your cells to be used for energy. But in type 2 diabetes, your body becomes resistant to insulin, or it doesn't produce enough. This means glucose builds up in the blood instead of being used by the cells. Over time, this can lead to serious complications affecting your heart, eyes, kidneys, nerves, and more. But how can you recognize it early? Let's talk about the symptoms. Symptoms of type 2 diabetes. Type 2. Diabetes often creeps in silently, but your body always sends signals, if you're willing to listen. Watch out for these early warning signs: increased thirst and frequent urination, unexplained fatigue or sluggishness, blurry vision, slow healing of wounds or cuts, tingling or numbness in hands or feet, increased hunger, even after meals, darkened skin around the neck or armpits. If you notice any of these symptoms, it's time to take them seriously. Early detection is your first step toward prevention. But what causes this condition in the first place? Causes and risk factors. Type 2. Diabetes is not caused by a single factor. It's a mix of lifestyle, genetics, and environment. Here are some of the most common causes and risk factors. Unhealthy diet, high in sugars, processed foods, and low in fiber. Lack of physical activity. Being overweight or obese, especially with abdominal fat. Family history of diabetes. High blood pressure or abnormal cholesterol levels. Age. Though it's more common after 45, it's increasingly seen in younger adults. Even teens' ethnicity. South Asians, African Americans, indigenous groups, and Hispanics have higher risk. If you fall into any of these categories, now is the perfect time to reevaluate your lifestyle. The next question is, what can you do about it? Treatments and lifestyle changes. The treatment for type 2 diabetes isn't just about medication, it's about transformation. Here's how you can take back control. Healthy eating focus on whole foods, vegetables, fruits, whole grains, lean protein, and healthy fats. Minimize refined sugars and processed carbs. Regular physical activity. Aim for at least 30 minutes a day, 5 days a week. Walking, swimming, yoga, anything that gets you moving. Weight management. Even losing 5 to 10% of your body weight can make a significant difference in blood sugar levels. Monitoring blood sugar. If diagnosed, tracking your glucose helps you stay on top of your condition. Medication. Your doctor may prescribe oral medications or insulin based on your blood sugar levels and overall health. Stress management, chronic stress, can raise blood sugar. Meditation, deep breathing, and even hobbies can help. Remember, managing diabetes isn't a destination, it's a lifestyle. A wealthy life begins with a healthy body. Frequently asked questions. Question 1. Can type 2 diabetes be cured? Not exactly, but it can be reversed, or put into remission through diet, exercise, and weight loss in many cases. Question 2. Can young adults get type 2 diabetes? Yes. Increasingly, teens and people in their 20s and 30s are being diagnosed, largely due to sedentary lifestyles and poor dietary habits. Question 3. What's the difference between type 1 and type 2 diabetes? Type 1 is autoimmune and usually diagnosed in childhood. Type 2 develops over time and is mostly lifestyle-related. Question 4. Is insulin always required? Not always. Many people manage with diet, exercise, and oral medication. But some may require insulin therapy eventually. You don't have to wait for a diagnosis to start making better choices. The road to a disease-free, energetic, and wealthy lifestyle begins with awareness and action. Let this be your turning point. Take a moment today to reflect. Move your body. Choose whole foods. Book that checkup. Because health isn't just about avoiding illness. It's about living fully. And if you're curious about how other chronic conditions affect your health, don't miss our next video. COPD explained in 5 minutes. Chronic obstructive pulmonary disease, linked right here. Stay informed, stay inspired, and as always, stay healthy.